Vitamins and minerals that are depleted by the prescription drugs you take. In today's world, every time somebody comes down with a cold they turn to prescription drugs. This might not be the wisest choice, if we are concerned with living a long and healthy life. In this fast-paced world we want a quick fix. Being down with a cold or disease like cancer is unacceptable. That's why most of us will turn to a prescription drug. Little did we know that as we take these prescription drugs they deplete our body of essential vitamins, minerals and phytonutrients our body needs to operate properly. Safeguarding our bodies against vitamin and mineral deficiencies should be our #1 priority. The following guidelines can help if you are one of the 20 million people out there using prescription drugs. Calcium. Calcium is the first mineral that can be depleted by taking prescription drug. These drugs include diuretics such as Bumex, Demodex, Diural, and Lasix, as well as bone-building drugs like Fosamax and anti-inflammation steroids. Cortef and Cortone can be deplete calcium in the body. You can help prevent calcium deficiency by eating foods rich in calcium. Foods rich in calcium are kale, cabbage, dairy, and broccoli. If you do not consume several servings a day of these vegetables, you might consider taking a calcium supplement. Coenzyme Q10. Coenzyme Q10 is an enzyme vital to the Krebs cycle, energy production cycle in the body. If you are taking cholesterol medication statins such as Lipitor, Lescal, Mevacor, Prevachol, or Zoca, you will be at risk of coenzyme Q10 depletion. Also, sulfonylureas drugs such as Amaryl, Gia-Beta, and Glucotrol for diabetics, you can be at risk. Eating foods high in coenzyme Q10 can help prevent CoQ10 deficiency. The foods containing CoQ10 are mackerel, red beets, sardines and organ meats. If you do not consume several servings of these meats and vegetables, you might consider taking additional coenzyme Q10 supplements available at any health food store. Folic acid. Folic acid is a B vitamin vital to both men and women, but especially women in childbearing ages. If you are taking cholesterol meds, pain relief medications or diabetic medications such as Questrin, Welchol, Celebrex, and Glucophage, you may be at risk of folic acid depletion. The following are foods high in folic acid. Broccoli, peas, beans, leafy greens, oranges and whole grains all have a good amount of folic acid in them. Folic acid is relatively inexpensive. You can find it at any health food store in 400 mcg and 800 mcg doses. Magnesium. Magnesium is vital for muscle relaxation and bone building. If you're taking diuretics, bone building, or steroidal anti-inflammation drugs, you might be at risk of magnesium depletion. Foods high in magnesium are leafy greens, lean meat, beans, nuts, whole grains, and seafood. Recent studies have suggested that 40% of the population are low in magnesium already. Taking prescription drugs that delete magnesium can put one at risk for disease related to magnesium deficiency. Potassium. Potassium is needed for proper nerve and muscle function. Also, potassium is essential for proper heart function. Prescription drugs that reduce potassium in the body are diuretics that reduce excess fluid and reduce blood pressure, levodopa that is for Parkinson's disease, and steroidal anti-inflammation drugs. The list of foods high in potassium are as follows: bananas, dates, brown rice, garlic, nuts, avocados, and spinach. You can also find potassium in your local vitamin store, usually selling at 99 mg per capsule. Vitamin A. Vitamin A is the next vitamin under attack, essential for proper eye development and immune system function. Vitamin A can be depleted by bile acid sequestrants, steroidal anti-inflammatory drugs, and Xenical. Xenical, a fat blocker, can also affect vitamin D and vitamin E. Foods high in vitamin A are as follows: fish, cod and salmon, liver and dairy. Thiamine, B1. Thiamine, B1, is involved in numerous body functions, including nervous system, muscle functioning and carbohydrate metabolism, to name a few. Drugs that may reduce B1 in the body are antibiotics that help fight infections and diuretics. Foods high in B1 and other B vitamins are nuts and whole grains. You can find single B vitamins or B complexes at your local health food store. B vitamins are vital for proper stress management in the body as well. They are essential keeping your body healthy, and taken daily can help prevent drug-related deficiencies. Riboflavin, B2. Riboflavin, B2, is required for cell growth and release of energy, formation of red blood cell, and synthesis of antibodies. Drugs that can delete riboflavin is Elevin for migraines. Foods high in riboflavin are dairy, lean meat, broccoli, and whole grains. B2 can be found at your local vitamin store. Pyridoxine, B6. Vitamin B6 helps the body process protein and carbohydrates in food and helps produce hemoglobin, red blood cells. High cholesterol medications like bile acid sequestrants and steroid anti-inflammation drugs delete B6 in the body. Foods high in vitamin B6 are fish, leafy greens, bananas, and potatoes. Vitamin C. Vitamin C is a great antioxidant to protect your body from free radical damage, helps strengthen blood vessels and reduce the incident of bruising when you bump your arms and legs on something. Diuretics and steroidal anti-inflammatory drugs deplete the body of vitamin C. If you are taking these types of drugs, make sure you consume lots of broccoli, citrus, potatoes, tomatoes and strawberries. Additional supplementation of vitamin C can help as well. Vitamin C can be found at any health food store. Vitamin D. Vitamin D is important for strong bones and teeth, and recent studies suggest vitamin D may even help fight some kinds of cancer. If you're taking barbiturate sedatives like Butasol and phenobarbital for anxiety or insomnia or blood pressure and steroidal anti-inflammatory drugs, you could be at risk for disease involving vitamin D depletion. Sunlight is the primary way our bodies produce vitamin D, and with our fast lifestyles, nobody has time to lay in the sun for 30 minutes a day. If you live in the north, you receive very little vitamin D from the sun. Supplementing vitamin D is essential for optimal health, available in 400 IU and 1000 IU doses. Zinc. Zinc is essential for proper immune system function, hair, skin and nail formation. Taking antacids like Pepcid, Prilosec, Tagamet and Zantac, also diuretics, and steroidal anti-inflammatory drugs will deplete your body of the essential mineral zinc. Zinc is found in lean meat and seafood, also can be purchased in 10 mg 100 mg doses in your local vitamin store. These are only a few of the essential vitamin and minerals that prescription drugs deplete from the body. It is important to eat your fruits and vegetables with every meal of the day. Most Americans do not eat the daily recommended fruits and vegetables required to stay healthy, so alternative vitamin supplements are needed more and more every day. Biochemists have found that the nutritional values of fruits and vegetables have been steadily declining over the past 40-50 years due to the fast-growing varieties the farmers are growing today. If you do not consume the recommended servings of fruits and vegetables, consider taking a multivitamin supplement every day. If you're not currently on a prescription drug and considering taking one, please consult your doctor about all the known side effects and health issues that might result from taking the drug. Remember, knowledge is power. Please like, subscribe and share the video and help us get our first 1,000 subscribers. We make videos like this every day to help your health and natural fitness.